FibroScan is a unique and patented device dedicated to liver elastography, designed to evaluate the state of the liver in a non-invasive and painless way. The examination is quick and easy, and the device can be operated by physicians or nurses. Previous experience in ultrasound is not required. FibroScan can be operated on all patients, who should be fasted for at least 2 hours prior to their assessment. FibroScan, also known as vibration-controlled transient elastography, is used in the context of chronic liver disease, since it enables the simultaneous measurement of 2 distinct quantitative parameters. The liver stiffness or elasticity expressed in kilopascals, correlated to the amount of fibrosis in the liver. The controlled attenuation parameter, or CAP, expressed in decibels per meter, correlated to the amount of steatosis in the liver. Examination is performed with a dedicated probe placed in front of the right lobe of the liver. Explored volume is approximately 3 cubic centimeters. Let's now review the consecutive steps of a FibroScan examination. The patient should lay on his back in the dorsal decubitus position with the right arm behind his head in maximal abduction. In some cases, it might be useful to shift the legs of the patient to the left in order to make the intercostal spaces wider. The FibroScan operator shall sit on a height-adjusted stool parallel to the right side of the bed and be able to check the probe position on the patient's skin and also the indicators displayed on the system. To start an examination, click on the Acquisition button on the main FibroScan window. You can now fill out patient details. Click on the Start button to launch the examination. You are now in the FibroScan Acquisition window. On the left side are displayed the ultrasound signals received by the probe in real time that will help you to select and adjust the probe position in front of liver tissue. On the right side of the screen is displayed the shear wave map, or elastogram, which is a map of travel of the elastic wave through the liver at each individual measure as function of depth and time. At the extreme right of the screen are displayed the number and list of individual stiffness measures. Below the ultrasonic signals and shear wave map are displayed the exam results, in blue for the CAP expressed in dB per meter, and in orange for the liver stiffness expressed in kilopascals. At the bottom of the screen, you can see the probe selection zone. Probe recommendation will be automatically displayed in this area during the examination, based on the thickness of the subcutaneous tissues, also known as skin-to-liver capsule distance. Select the appropriate probe by clicking on the corresponding button. You will still have the possibility to switch to another probe during the examination, if suggested by the automatic probe selection tool. To choose an optimal measurement point on the right lobe of the liver, localize the xiphoid appendix just below the sternum, and then draw a line to reach the mid-axillary line. Make sure the probe is placed between the ribs, avoiding any contact with the rib cage since it would cause unreliable measures. The right forearm should rest on the bed alongside the patient's chest. All the weight of the probe should be within the right hand. The left hand helps keeping the probe correctly positioned. For muscular patients, ask them to bend the arm down to avoid too much tension in the muscles. That could affect the quality of the scan. It is advised to position the probe in a zone free of tight muscles. To adjust your probe position in front of liver tissue, review the real-time ultrasound signals displayed on the left side of the acquisition screen. The TM mode on the left must be layered without any heterogeneity, and the decrease of the A mode on the right must remain linear, which together corresponds to the typical acoustic signature of the liver. Take your time and try different spots to find the most accurate probe position before pushing the button. Any measure taken in a non-liver area will be determined as invalid by the FibroScan algorithm. Accurate probe positioning is always associated with a green aspect of the liver targeting tool indicator, which is displayed right above the ultrasound signals and reflects the homogeneity of the measurement window. The more green, the better the current probe position. The following signals shall be avoided. Presence of a vessel structure. Heterogeneous region of measurement. Measurement performed in the upper border of the liver close to the lungs. Lack of ultrasound gel. Measurement performed in a non-liver area. A suitable probe positioning would be characterized by this type of signal, with homogeneous layered TM mode, linear decrease of the A mode, and green liver targeting tool indicator. The probe has to remain perpendicular to the patient's skin during the whole examination. The probe must be perpendicular along both axes. If the probe is not perpendicular, this might lead to unreliable results. The pressure applied on the patient's skin is monitored by the system. The LEDs on the probe will be on only when the pressure is suitable to trigger the measure. Triggering a measurement is not possible when pressure is too high or too low. When the position of the probe, pressure, and perpendicularity have been successfully checked, the operator should then trigger at least 10 successful measures at the same position. After each individual measure, it takes just a few seconds for the FibroScan to display the corresponding cape and elasticity results. The quality of the shear wave propagation must be checked on the associated elastogram. A correct shear wave map or elastogram must feature a clean shear wave visible throughout the entire measurement window with parallel margins. Incorrect elastograms are caused by technical operator mistakes. A probe tip in slight contact with a rib cage could lead to incorrect elastograms called A or E waves and lead to stiffness overestimation. A and E waves are characterized by non-parallel sides of the elastic wave on the elastogram and shall be avoided. Scanning overweight patients with an inaccurate probe might cause an angled wave on the elastogram due to the presence of subcutaneous fat tissue in the region of measurement. Angled waves should also be avoided since they might cause stiffness overestimation. When your examination is completed, click on the End button to save the examination data and to deactivate the probe. Results displayed on the screen are the median of the valid liver stiffness and cape measures performed within the current examination. Interquartile range of elasticity and CAP, also known as IQR, reflect the dispersion of individual measures. IQR over median ratio should not exceed 30% to ensure a reliable liver stiffness result. If higher, it is advised to perform a few additional measures or to restart the entire examination. Once the examination is completed and the probe deactivated, use a soft paper towel and gently remove the gel from the tip of the probe. Make sure that you disinfect the probe with a non-alcoholic solution between each patient and replace the probe in its holder. We hope you enjoyed following this FibroScan tutorial. Please also take a look at the other tutorial videos to improve your FibroScan practice, especially in hard-to-scan patients. The EchoSense training team will be happy to answer any additional questions. Please feel free to contact training@echosense.com.